Hello, my name is Juan Mendoza, and I chose to focus on gender-based disparities in healthcare for my research presentation. So, why did I choose this topic? Because this affects all of us in some capacity. The well-being of people around the globe is influenced by gender-based discrimination. The presented research explores a broad range of biases, discrimination, and inequities that have an impact on how people of various genders experience healthcare. This research attempts to conduct a multifaceted analysis of gender-based discrimination in healthcare, highlighting its effects on patient care, public health, and societal justice. This research presentation hopes to promote patients' knowledge of gender prejudice, equip them with the knowledge to identify it, and the capacity to advocate for themselves or others when it occurs. The purpose of this study is twofold: to identify how gender-based discrimination presents and how it affects patients, and to identify contributing factors to gender-based discrimination in healthcare. So let's talk about literature review. First, we have the physician's responsibility. Medical gaslighting refers to when a medical expert ignores a patient's complaints. This is not always intentional. Medical professionals are taught to hunt for the most typical diagnosis. They call this looking for horses instead of zebras. Unfortunately, this strategy could result in downplaying a patient's symptoms. There's also disparities in pain treatment. Women are less likely than men to be prescribed analgesia. Time to analgesia analysis also found that women were delayed in their pain treatment compared to men, particularly with opioids. So, why don't patients speak up or advocate for themselves? Failure to speak out may be a result of conditioning. Confusion, self-doubt, and mistrust in individual experiences may result from frequently being invalidated. Research also found that a significant percentage of women have felt silenced or ignored in their workplace as well as in their treatment in hospital setting. Lifestyle also plays a major factor. For example, women are more likely to have a physician but less likely to follow the lifestyle changes that physicians recommend due to other commitments. So, what can help? Research suggests that higher education may correlate with acknowledging women's perspectives. Medical professionals who underwent additional training led to an improved in gender-related knowledge, attitude, and medical practice. So let's talk about design. This study utilized a secondary analysis research design to review and reanalyze previously obtained data. The data used in this study was sourced from multiple peer-reviewed publications. Data from surveys, test assessments, and observational and existing data from the original studies allow for the exploration of facets pertaining to the research question. Thematic analysis of the data will help find any patterns or themes. So this study searched for other studies that involved healthcare professionals, including medical students. Studies with gender-specific data were sought out, both on part of the patient and the provider. This was to spot any patterns between patient treatment based on gender or provider care based on gender. The geographic location for data was not limited by country or state. Participants in the study were provided with informed and written consent. I'm going to turn my camera off for a little bit so you can see the chart that I shared here from the study. So this study looked at the difference in opioid treatment, and they used a bivariate analysis to compare female and male patients and the distribution of pain medication. When comparing all patients, those less than 50 years old and non-gender specific diagnosis, women received less pain management medication compared to men. Women are less likely to receive opiate medication compared to men in every category. So this study also separated the gender of the physician along with that of the patient, and it even had their attending or resident status. So this one used another bivariate analysis of analgesia administration. So across the board, Female patients receive less pain medication compared to men, regardless of the gender of the provider or the resident status, by about 10%. Attending female providers analgesic treatment 1% more often compared to attending male providers. Resident female providers provided analgesia treatment 6% less often compared to resident male providers. This study also uses the bivariate analysis and Likert 6-point scale that was used to measure the attitude of gender-specific medical curriculum among women and men. Across all but one of the items reviewed, women had more positive attitude towards the lectures and learned material. First-year medical students also appear more receptive to gender-specific curriculum compared to fifth years. So let's reflect a little bit on what we've talked about. The analgesia administration study is limited by the fact that it is conducted exclusively with emergency department patients. It is possible that treatment is more gender inclusive when the patient is seeing their primary physician and triage is not involved. A strength of this study is that it looks not only at the treatment of the patients by gender, but also at the gender and residency status of the provider. Resident female providers provided the least amount of pain management, and resident male providers provided the most despite the gender of the patients. This may suggest a level of apprehension from less experienced female providers and hubris from less experienced male providers. So the data suggests the need to increase engagement efforts with male and fifth-year medical students when it comes to gender-based medical curriculum. This study is limited in that it only involved medical students and not hospital staff, even if they are rotating in hospitals. This data may indicate that the longer someone has been in a practice, the less malleable their perception will be. This may also suggest a level of herd mentality of gender discrimination inside hospitals, as students do not begin rotating into hospitals until their third or fourth year. So let's start wrapping this up. The purpose of this study was to identify how gender-based discrimination presents, how it affects patients, and identify contributing factors to gender-based discrimination in healthcare. Although several aspects of this issue were found meeting the purpose of the study, this multifaceted issue still has a lot of room for study and scrutiny. None of the utilized studies use the sexist attitude towards women scale or the everyday discrimination scale. Although the studies did an excellent job of tracking their data, using these scales with healthcare professionals may provide more definitive data. Here are some fun references of all the studies that I use in this presentation. Thank you for your time.